Guys, welcome back to Sums Up. Today we are here with another video, Dementia. So before beginning this video, I want to tell that medicine isn't just about memorizing long paragraphs. Also about recognizing patterns. Both important, of course, but here on this channel, I'm going to help you learn how to pick patterns in exam and not just remember texts. So being said that, let's begin the video with definition. A chronic progressive decline in cognitive function severe enough to interfere with daily life and independent functioning with intact consciousness. Intact consciousness. In dementia, we have intact consciousness. In delirium, we have waxing and waning of consciousness. Remember this. In dementia, we have intact consciousness. And dementia is irreversible. There are several types of dementia. We will discuss it on the next slide. And second thing on this is it is commonly affects memory, language, judgment, behavior, executive function, and personality. Remember these things: memory, language, judgment, behavior, executive function, and personality. The different types of dementia you would see on exams, on steps, on Comlex, and every different exams. They just the timing between these symptoms define different kind of types of dementia. I would explain it later, but remember these: memory, language, judgment, behavior, executive functions, and personality changes. So, beginning with the types of dementia, there are 10 types of dementias: Alzheimer's, vascular dementia, Lewy body dementia, frontotemporal dementia, Parkinson disease dementia, normal pressure hydrocephalus, Huntington disease, Creutzfeldt-Jakob disease, HIV associated dementia, and Wilson disease. These all can cause dementias. And in exams, when you do Q banks, these questions get again and again, and people can't differentiate between different kinds of dementia. When I was solving those question banks, I would get them frequently wrong, and I couldn't explain between differences between them. Today I am going to tell all the differences between them, and you are gonna learn how it works. So beginning with Alzheimer's disease, I'm not gonna tell you that it is an autosomal recessive disease and it's acetylcholine. You know, I expect you to know all this. I'm gonna just tell you the differentiation between different types of dementia, so on exam day you can differentiate between different types. So Alzheimer's disease and frontotemporal dementia, people often confuse between these two, and including myself. So Alzheimer's disease is the most common dementia. So the first symptoms in Alzheimer is anterograde amnesia. Okay, there is abnormality with the new forming memory, and people keep forgetting their uh, things. Difficulty remembering recent events, late personality and functional decline. So it is a progressive disease. The first symptoms are anterograde amnesia, and the late personality, and the later changes are late personality and functional decline. We often have this buzzword that whenever we see personality changes, we often associate with frontotemporal dementia, but you does not have to do it all the time. Sometimes question stems show that a patient has dementia from 10 to 15 years or 5 years and there are personality changes, so then Alzheimer's is the right answer. But if the personality changes are in acute settings, like dementia is not established and patients start to change his behavior, then it's most likely frontotemporal dementia. So the recognition clue for Alzheimer is memory loss first, and frontotemporal dementia, its behavior changes first. Moving on next, it is Lewy body dementia and Parkinson disease dementia. People different get confused between them. So whenever the scene is like you have motor symptoms and you have hallucinations. Now these both are present in Parkinson. Okay, but the timing of these is very important. When dementia develops within 1 year of motor symptoms, when dementia develops within 1 year of motor symptoms, this is Lewy body dementia. Lewy body dementia in within 1 year of motor symptoms. If it get more than 3 years, then it's Parkinson disease dementias. Secondly, hallucinations are more of a characteristic of Lewy body dementia than Parkinson disease, but here the actual thing is timing. You should focus on timing. If it's more than 1 year or more than 3 years, then it's Parkinson disease dementias. And in Parkinson, we have motor symptoms first, like um, uh, tremors, rigidity, akinesia, and uh, postural instability. That's trap. That Parkinson symptoms appear first and then we develop dementia. That's Parkinson for you. Okay, vascular dementia. It is a stepwise decline in cognition, and for this, the stem must contain history of strokes or hypertension. If you see hypertensive patient and cognitive function loss, like if he had uh, stroke earlier and he was having hyperreflexia, and 2 to 3 months later he had another stroke and he has now dysphagia, can't talk and that kind of stuff, and it's progressively increasing, then it's vascular dementia. Stepwise decline is always vascular dementia. It is the second most common dementia after Alzheimer's disease. Moving on ahead, we have normal pressure hydrocephalus. It's the easiest one. Whenever you see urinary incontinence, gait disturbance in cognitive decline, try it. It's normal pressure hydrocephalus and nothing here. Okay, Wilson disease. Same, if Parkinson develop in a patient less than 40 years of age, then it's Wilson disease until proven otherwise. Young patient with Parkinsonism is always Wilson disease if it's less than 40 years. We can check Kaiser-Fleischer rings on slit lamp, and if Parkinson plus liver is involved, you have LFTs abnormal and Parkinson abnormalities, then you have Wilson disease. Moving on ahead, we have Huntington disease. It is an autosomal dominant disorder, Korean abnormal movements, psychiatric symptoms common, progressive cognitive decline. The recognition clue is chorea plus dementias, Huntington disease. So in for this, they often give the family history, like the father died in due to depression or that kind of stuff. So it's easy to get on exam. You don't get that much confused between them. Creutzfeldt-Jakob disease, also a kind of dementias. It is a prion disease, rapidly progressive dementias. Myoclonus, common myoclonus is like a buzzword for Creutzfeldt-Jakob disease, and fetal neurodegenerative disease. Recognition is very rapid dementia and had very poor prognosis for this. HIV associated dementia, the last dementia we have, occurs in advanced HIV infections, cognitive slowing, behavior and memory changes, difficulty in concentrating. The recognition clue is dementia in immunocompromised patient. It is always HIV associated dementias. So the reason for this whole video was to just let you see how different you can differentiate between different dementias. You have a lot of questions. As I'm solving QBank for step 2, I see a lot of them. In step 1 there were a lot of them. You also need this for your university exams, your preps, to pick these things on exam. You need to know all about Alzheimer's, but you also need to know how to differentiate between Alzheimer's and frontotemporal dementia. So hopefully you like my video, and thank you for watching. Don't forget to like, subscribe, share, enjoy, and